the JAMA Network.
Ralph Dineen was diagnosed with type 1 diabetes more than 32 years ago.
When I became diabetic, it was a very confusing moment in my life. I was about 30 years old, and it came out of nowhere at me.
He wears an insulin pump and tests his blood sugar 5 times a day. Ralph participated in the Diabetes Control and Complications trial that started in the mid-1980s. Half the participants, including Ralph, were instructed on how to maintain tight control of their blood sugar. The other half controlled their sugars more loosely. This went on for nearly 7 years. The current study was designed to determine whether this intensive blood sugar control would help reduce long-term complications like vision loss, kidney failure, nerve damage, and heart disease.
Tighter blood sugar control reduced those complications by as much as 60 to 70%.
Dr. David Nathan from Massachusetts General Hospital and co-authors continue to follow these patients after the study ended in 1993. They wanted to see whether those who maintained tighter blood sugar control early on also reduced their long-term risk of death.
And it turns out that although the entire group is doing quite well, including those who were originally on conventional therapy, those with intensive therapy have a reduction in mortality by about 33%.
The study appears in JAMA, Journal of the American Medical Association.
People with type 1 diabetes are not only doing better if they have intensive therapy, but that their lifespan is probably approximating that in the non-diabetic population. There is no thickening of the lens, so there are no cataracts developing, which is great.
Ralph says his kidney function remains normal and hopes to maintain his good health during the coming years.
To be able in 20 more years to look back and say, wow, that's amazing. I'm now 85. This has been good. And keep going.
Catherine Dolf, the JAMA Report.